Penile implant surgery. Your questions and answers with Dr. Christopher Love, urological surgeon, brought to you by FixedED, www.fixeded.net.au.
Really, there are several treatment options available for erectile dysfunction. A man can just put up with the problem and accept it, and for some men that's all they want to do. They perhaps want to know why they have the problem, but then they won't do anything about it. But if a man's seeking treatment, his options really are to use oral medications, and these are the commonly known drugs that have been around for some years now, taken orally half to 1 hour before the man wants to have intercourse. They enable the blood vessels in the penis to open up to cause an erection that way. They don't work unless there's sexual stimulation, and they certainly won't work for all men, and there is a delay from when you take the tablet to when you get a benefit. The other commonly used treatment is to use injections into the penis, where a man learns to inject a medication directly into the side of the penis, and that medication enables the blood vessels to open up and cause an erection. Will work for a lot of men, but it's not a very popular treatment because of the discomfort associated with the injection, the fact that you need to actually physically do something to obtain an erection, and it also has the issues with potentially causing scarring and damage inside the penis, and that may stop the injections working ultimately, or damage the penis to such an extent that other treatments such as a penile implant won't be as satisfactory. Some men are prepared to use what's called a vacuum device, which is essentially a plastic tube that goes over the penis. It has a pump attached to it that enables a suction to occur within the plastic tube, so the penis gets drawn up into an erection-like situation. It's kept that way by a soft rubber ring that goes around the base of the penis after the plastic tube's removed. Now, it really doesn't cause a very hard erection, and the erection the man gets is cold and blue because the rubber ring is stopping blood getting into the penis. But for some men it's enough for them, and they're satisfied to use that. All those things are really ways of obtaining an erection. They're not actually fixing the problem, they're just ways of a man getting an erection, and many of them may be suitable for some patients. But currently the only way we have of fixing erectile dysfunction is to put a penile implant inside the penis. A normal erection means that blood goes into the penis and fills up the spongy spaces inside the penis. The blood gets trapped in the penis, so the penis gets hard. What we do with a penile implant is we also have fluid go into the penis to make the penis hard, but that fluid is within cylinders, plastic cylinders that we put inside the normal spaces of the penis. So it's still what you might call a hydraulic erection, that is, fluid goes in, the pressure builds up, but it's now completely under the man's control. He can have an erection whenever he likes, as quickly as he likes, and as often as he likes. And that's really why a penile implant is the only way to fix erectile dysfunction.
Penile implant surgery. Your questions and answers with Dr. Christopher Love, urological surgeon, brought to you by FixedED, www.fixeded.net.au.